Please. Okay, good morning, everyone. I'm very appreciated to present our research project about the perception of educational environment in patient worse among clinical medical students in Ratchaburi Hospital. This research is done by the Apichaya Pitakchuen and Hananya from Medical Education Center, Ratchaburi Hospital. Let's start with the background. I think everyone knows that the educational environment play a critical role in shaping the learning experience and academic achievement. To improve the educational environment is important as the one who will deliver the case of care to patient is all of our students. By the way, in Ratchaburi Hospital, there is no routinely assess about the educational environment by the standard tools. So this research aim to fill this gap and identify the opportunities for further curriculum improvement. So at the start of the research, we used the Dundee Ready education environment measure to administer to the six-year clinical medical students in 13 clinical rotation. Uh, about the dream questionnaire, this is comprehensive 50 items questionnaire. Evaluate the educational environment across 5 domains. That is student perception of learning, student perception of teacher, academic self-perception, perception of atmosphere, and the last one is social self-perception, with each domain have a different item on each domain. But and which each item was rating in like a scale from 0 to 4, which 0 means that strongly disagree and 4 is mean strongly agree. So everyone is required to score for 50 items per one clinical rotation for all of the 13 clinical rotation. So the receiving data can be analyzed into 3 level score. First is overall score, second is domain score, and the last one is individual item score. Uh, Here is the result. The first graph shows the mean of the overall score across all clinical rotations. You see that all the clinical rotations have a score range from 100 to 150. Means that there is a generally positive educational environment in Ratchaburi Hospital, with some area for improvement because of the maximum score of overall score is 200. And this graph shows the mean score of each domain score across the all clinical rotation. If combining this result with the individual item score, which I cannot show in this presentation with some limitation, we will receive the following key domains about the strengths and challenge of the all 5 domains. To be concise, the strengths include a high perception of learning score, especially in pediatric gynae and emergency medicine, recognized for the teaching process, with fostering competence, student involvement, and effective teaching time. The perception of teachers was also highly positive, particularly in pediatric gynae and psychology, praise for the patients and teachers' ability of effective communication. On the other hand, the challenges include an overemphasis on factual information and the obstacle on memorizing all the necessary material highlighted in medicine and surgery, impacting an academic self-perception. And another challenge is the too much teacher-centered environment that's suggesting a shift into a more interactive and student-centered learning. In the perception of atmosphere in some clinical rotation, reported an uncomfortable environment. This is another area for improvement. And the last one is the student fatigue. That is a common issue across all clinical rotation, uh, suggesting that we should improve the workload management and more student support system. In conclusion, this is a recommendation we can do to improve the educational environment in Ratchaburi Hospital. Yes, this is all for the research. Thank you. Yes, our project include 27 participants because of the limitation that we want to include the population that pass all the 13 clinical rotation, which some rotation we have an opportunity just in the sixth year. Yes. So this is one of the limitation of this study with the less population in the study.
So the so each one evaluate every ward, every rotation, right?
Yes.
Okay.
Thank you very much. That's really interesting. I was wondering about when the students completed the DREAM questionnaire. Was it at the end of the clinical rotation or at the beginning, or was it at different times?
Yes, I performed this research around November to December last year when all the student has all the 13 clinical rotation. So there is maybe some like recall bias to fill the questionnaire. So another recommendation to do in further research or to bring this research done in the real life is to take this questionnaire into a standard tool and imply in daily life of the medical center to use to evaluate every year of the educational environment.
Thank you.
Do you have any plans to do any interviewing of anybody to dig a little deeper into things, or do you feel that the DREAM questionnaire is sufficient for your needs?
I think this is like a first phase of the research. I think I want to give all of the collected data into the medical center, my medical center, to pick some of the important data that we receive that is a potential potential point that can be improved and do more research in that detail of the area to improve the curriculum. Yes. I mean, research deeply into that potential part and maybe we can find another intervention to improve the curriculum or educational environment in Ratchaburi Hospital.
So just last question. I wonder 2 points. You said that you use the DREAM questionnaire to evaluate the perception of educational environment.
Yes.
And do you use Thai version or an original English version?
I use Thai version.
Okay, so any pilot test before to do you have any pilot test to validate uh, clear understandings of all participants before you go into the questionnaire to the real research?
Yes, that is another recommendation that if my medical center will use this data, they should validate. They should do that pilot program and validate the understanding of the question of the student again. Yes, before take this data to improve.